Hey, my name's Dr. Louis Mariuso. I've been doing dentistry for over 7 years now, and I'm located in Knoxville, Tennessee. You often hear that implants can last a lifetime. They certainly can in the right environment, in the right circumstances, in the right situation. I never like to say something is forever. We're obviously replacing something that you were born with and you were given. So this is the very best that we have in dentistry and the very best that we have currently in technology. So studies show that implants have a 95 to 97% success rate over 2 or 3 decades. Those are better odds than a bridge would be, or a root canal would be, or even a filling, which is made to last 7 to 10 years. I don't like to say that terminology, this is going to last you your whole life, just because somebody will hold me to it. And if there's any issues, we'll be there to address it and help them with it. I'm confident in it as a treatment modality because I do think, as far as technology goes, as far as dentistry goes, it is the very best and most predictable approach that we can have to replacing missing teeth. There are a few factors that can shorten the life of implants. Some of the big ones that come to mind is definitely smoking. Cigarettes can not only negatively impact several other areas of the body systemically, but it can very much directly impact the longevity of your implants. We always check these things and ask these things on the front end before we go down that road because we want to know what sorts of complications could we run into. If somebody says they're smoking a pack a day or 2 packs a day, we're going to go into it pretty truthfully and transparent and say, that 95 to 97% success rate, that's not going to apply in this circumstance. You're really going down to that 75% area. And so I never tell anybody to do anything. I don't say, you got to stop smoking, but it should be something you should consider if you're wanting to go down this road and, make the investment on the implants. So definitely cigarettes has a very negative impact on the longevity of the implants and the health of it being able to last 10, 20, 30 years, which is really what you're wanting from the treatment. The other thing that has a negative effect too is uncontrolled diabetes. What that means is your body's ability to repair and heal itself is impaired, right? So early on, when we're planning for implant placement, we always like to ask patients, what's your A1C if they are a diabetic? And those who are diabetics, they always know what that number is. And that's just a measurement of their blood sugar over the last 3 months. And so anything above an 8, that means it's uncontrolled. And that means if we move forward and place implants, the body is most likely going to reject those implants. We don't want to get into a situation like that where the patient has invested in this treatment. Preparing on the front end is important, and also making sure biologically, we talked about the bone cells, the body's ability to heal, make sure that those things, are aligned. There are a small number of implants that fail or get rejected. In our practice, when we've experienced that, typically the solution is to just try again. And so we'll rebuild the site, do it a second time. Almost always that seems to work. If the implant still doesn't take or implants don't take, then there's a systemic issue going on with the patient that maybe the patient wasn't aware of and that we weren't aware of. And so that, leads to other things that they need to start exploring. We always make night guards for every implant patient that we have, whether it's a single implant or a full arch zirconia. They're going to leave our practice with a night guard, and we make them inexpensive on purpose. Down the street, they'll charge you 3 times as much. In our office, we have our 3D printer. We can make it custom fit, and we don't want that to be a reason why their investment of thousands of dollars doesn't work after a couple years. So that's important. Taking care of it with your night guard when you go to sleep, making sure that you're living a healthy lifestyle in terms of reducing chewing tobacco, making sure that things like your blood sugar, your diabetes is under control. Things that you can control, that's up to the individual patient. The things that we can promise is that we're going to do the very best job, that with our experience, we're going to place it properly, that it's going to be the very best type of implant that you can use and restore the implant with the proper materials. And we have full control in-house of the entire process. So in terms of being able to say, we did a great job, that's on the front end, but being able to take care of it, every person has to do that on an individual, standpoint. Implants have evolved over the years and they get better and better and better over time. I've seen implants that have lasted decades, like 20 years, 30 years. And back then, the design and the science behind it was completely different. A lot of things that can help the longevity of those type treatments, one of them really just comes down to genetics. Some of us are just, made differently. There's a big part of it that we just have no control over. So that is just, it is what it is. Some of us have more dense bone. Some of us have more bone to work with. Some of us have a certain biotype in our gum tissue that is going to help protect the implant more. Some of us eat healthy all the time. The patients that I've seen, they've taken care of it. It's like, if you buy a really nice car, you're going to take care of it. You're going to wash it. You're going to make sure the oil is always right. And it's like one of those things. The ones that really do last are the people who were intentional on making sure, like, oh yes, I'm going to really take care of this. I don't want to go through that again. So I'm going to change my habits. I'm going to change my ways. I am going to take care of these teeth. I'm going to use my water pick 3 times a day. I'm going to brush it. I'm going to come in here every 6 months and make sure I get my x-rays and get everything cleaned. And so if anything does happen, we can catch it early on and prevent things. Those are my experiences with patients who have implants that have lasted, that long. I understand that you're nervous about this. Obviously it can feel very overwhelming, but I want to give you comfort in the fact that you're not the only one. There are lots of people in this situation. It doesn't matter what happened and why you're in that situation. What matters is that we're here to help you. And so what we want to do is think about the positive things that are going to come from this. You mentioned that you're hiding your smile. You mentioned that you don't go out as often as you did because if you go to a restaurant to socialize with family and friends, like you're afraid that your denture might fall out or a tooth might break. And so it can slowly creep up on us on how just deteriorating dentition just starts to affect every aspect of your life. But I want to bring you comfort and tell you that the patients that we've seen in the same circumstance, once they have completed treatment and gotten through treatment, how they've changed. Their confidence changes, their appearance changes, and they just become more outgoing. They're smiling again. They're eating the things that they couldn't. A lot of the comfort is going to stem from our team's ability, which is we have a lot of experience in this type of dentistry and taking care of so many patients in that same circumstance that you're in now. So just try to visualize what life could be like with teeth that look good and function well too.